So we started from normal cell, then the cell try to adaptation like hyperplasia, hypertrophy, metaplasia, atrophy or dysplasia. Once it failed to adapt, it moves toward the reversible cell injury. Then, after reversible cell injury, we'll see two morphological patterns. One was cell swelling, and one is fatty change. Fatty change. After this, it reaches at 2 point, that is point of no return. Point of no return. And these two are severe mitochondrial damage and severe cell membrane damage. After it enter into irreversible cell injury. After irreversible cell injury, cell death occurs. And there are two patterns of cell death. Two patterns of cell death. One is necrosis and one is apoptosis. In this lecture, we'll cover necrosis, a pattern of cell death. So, as we see, most common cause of cell injury was hypoxia. It was hypoxia. Because of this hypoxia, reversible cell injury, then irreversible cell injury, and then cell death. And after cell death, we'll see the pattern, morphological changes called necrosis. So in case of necrosis, because of hypoxia, in reversible cell injury, the first change is cell swelling. Cell swelling. Cell swelling is there in necrosis. After cell swelling, when it reaches to irreversible cell injury, then there is mitochondrial damage, there is cell membrane damage. It means in case of necrosis, already there is cell membrane damage occur. Cell membrane is damaged. So if cell membrane is damaged, then there will be leakage of cell content. Necrosis, this is the cell and this cell membrane is severely damaged. That is also called point of no return. Because of severe cell membrane damage, there are lysosome. This membrane is also damaged. It is also kind of cell membrane. So enzymes leak out. Enzymes of lysosome, they leak out. Plus some enzymes or proteins, they also leak out. This leak out of some protein or enzymes, it act as a basis for blood test. It act as biomarkers of cell death, biomarkers of cell death, biomarkers of cell injury. So, for example, this is canine liver and this is canine hepatocyte. The most common cause of cell injury is hypoxia. Because of hypoxia, first reversible, then irreversible, then cell death. In case of cell death, these cell membranes are ruptured, severely damaged. So the enzymes will leak out, and they occur as biomarker. Example, in case of canine, will rise in the blood. So they leak out, and where they leak out? In blood. So in case of canine hepatocyte, SCPT, raise in the blood. That is sensitive marker. Similarly, in case of large animals, large animals like cattle, horse, in case the biomarker for cardiac injury, that is necrosis of heart cell. There is necrosis, that is cell membrane damage occur that may lead to leakage, leakage of the important biomarker in the blood. So this MCQ was asked in HPPSC VO exam 2021, that in case of large animal, the cardiac injury biomarkers are, so from this heart, what leaks out? They are the troponin I and troponin T. So there are two troponin T and I. Troponin T and troponin I. These are the biomarkers of cardiac injury, cardiac necrosis in case of large animal. T and I. So suppose we started with the most common cause, then reversible cell injury, that is nothing but the cell swell. This is the cardiac cell of large animal, and there is the swelling of the cell. After this, irreversible irreversible cell injury. In case of irreversible, cell membrane damage occurs. So Because of cell membrane damage, troponin T and troponin I, they leak out into the blood. Troponin T, troponin I, which are nothing but the biomarker of cardiac injury. So this is the significance of necrosis where in the blood you may find some biomarkers. So hypoxia, reversible for cell swelling, irreversible that is membrane damage, and this pattern is called necrosis. Necrosis. So there are two patterns of necrosis or two types of necrosis. One is coagulative necrosis and one is liquefactive necrosis. There are other, they are known as special type of necrosis. In special type, there is fat necrosis, there is fibrinoid necrosis, there is gangrene, which is also a special type of necrosis. So fat, fibrinoid, and there is caseous necrosis. Caseous necrosis. So these two are the basic, these are special. Out of these all, C for coagulative, C for common. So this is the common or you can say most common type. Common or most common type out of all necrosis. So first we'll see coagulative necrosis, liquefactive, then special. Coagulative necrosis. Coagulative necrosis, it is the most common type of necrosis. This is the most common type of necrosis. What is the most common cause? That is your hypoxia. And hypoxia is because of ischemia. So most common cause is hypoxia or ischemia. In case of coagulative, there is coagulation. There are structural proteins and lysosomal enzymes. Lysosomal enzymes. These two undergo coagulation or denaturation. They undergo denaturation. Because of these two, structural and lysosomal, they undergo denaturation. Because of this, cell outline, cell architecture is preserved. Is preserved. But if we see in liquefactive necrosis, these lysosomal enzymes, they will in case of liquefacting. It will make the things every liquid. But here, these two, they are denatured, coagulated. So cell boundary outline architecture preserved. But cellular content detail is lost. That is not preserved. So this is your coagulative necrosis. So structural protein and lysosomal enzymes, they undergo denaturation that preserve architecture of the cell or cell outline. But this is preserved for some days only, not permanent. For what happens after some days? What happens after some days? After some days, WBC leukocyte infiltration occurs. These are the leukocytes. They have lysosome. They they will release enzymes, lysosomal enzymes that may degrade these dead cell, necrotic cell, and remove these. So this is the fate where initially there is coagulation, denaturation, outline preserved. After some days, leukocyte infiltrate, they release their enzymes and they come and they remove, phagocytize, and dead necrotic cells. This is the story of coagulative necrosis. In short, next question is where necrosis seen? So answer where it is. It is seen in solid organs. It is seen in solid organs. What are solid organs? Kidney, liver, skeletal muscle, skeletal muscles. But not your CNS, not your brain. Solid means they have stromal support. Stromal support is due to collagen. So heart, kidney, liver, collagen, they have stromal support. That's why they are called solid organs. But why not CNS? Why CNS is not called solid organ? Because in case of CNS, no collagen. Therefore, no stromal support. Therefore, it is very soft. So it is not called a solid organ. Second is it is lipid rich. That is myelin sheath. Myelin rich. So organs, CNS is not a solid organ because no collagen, therefore no stromal support. These organs are called solid organ because of stromal support because of collagen. So coagulative necrosis, whose more seen in liver, kidney, heart, or skeletal muscle. Skeletal muscle. All solid organs. They have collagen stromal support. This coagulative necrosis is known as Juncker necrosis. Previously, it was called Juncker degeneration, but it is a necrosis. Degeneration is reversible, but necrosis is irreversible. Juncker necrosis, skeletal muscle. Common cause is hypoxia, so because it is a death, so hypoxia is death. But in case of, if I call hypoxic death in CNS, it is not called coagulative necrosis, it is called liquefactive necrosis. It is called necrosis. So this coagulative necrosis, the example is white muscle is cattle, sheep, white muscle is. One more example. One more example is infarction. We'll see what is infarction. Infarction. This is the heart where these supply of the heart. Plus the supply of the heart. If there is throat formation, then this area. So this localized necrosis is called infarction, and the area is called infarct. Similarly, if there is thrombus, then this area is called the infarct. So infarct is a small localized coagulative necrosis. So infarct is small localized coagulative necrosis. Because it is occurring in heart, so we call it myocardial infarction. So infarction is because there is thrombosis and that may lead to formation of infarct. So the sequence is first there is thrombus formation, the blood supply. First there is number one thrombus formation that may lead to interruption of blood, that is loss of blood supply. The localized cell death, cell death called coagulative process or simply called as infarct. So this area is called as infarct. So first it is blocked and it blood supply is not going because of there is hypoxia. Because of ischemia, there is hypoxia. Because of ischemia, there is hypoxia. No oxygen is coming, no glucose coming. So because of this hypoxia, most common coagulative necrosis. And this is called infarct. This infarct so it is started common cause thrombus which lead to ischemia, less blood supply, and if no blood supply, then no oxygen lead to hypoxia, and hypoxia lead to your infarct. Nothing but coagulative necrosis. This infarct is of two types: be white or pale, or it is also red or hemorrhagic. Hemorrhagic, where it artery present. For example, kidney and heart. Infarct is found in heart and kidney. Red art or hemorrhagic infarct is due to blood supply present, where loose connective tissue or loose blood supply present. So it liver dual blood supply, lungs dual blood supply, and it is also found in the spleen having full of blood supply. So red hemorrhagic infarct, it was asked in ICAR 2000, is present in answer was lungs because they have dual blood supply. And in one exam, this MCQ was caused. Infarct is an example of coagulative. In one exam, it was asked this coagulative necrosis, most common cause, hypoxia. Most common cause of hypoxia is ischemia. And common cause of ischemia is thrombus formation. So from this to this side or this to this side. So this was about your coagulative necrosis. So for three example, white muscle disease, infarction, and there are others. Number two is liquefactive necrosis. The other name is colliquative necrosis. Colliquative necrosis. Here you will find liquid mass. Liquid mass means no outline, no architecture, no architecture preserved. L4, there is role of lysosomal enzymes, lysosomal enzyme action. So everything becomes liquid. And where it is found? It is found. Okay. First, we'll see what is how it is started. Because it is necrosis. Necrosis means there is severe cell membrane damage. Necrosis means nucleus will be pycnotic, karyovaxis, karyolysis. Okay. The other thing is because of severe cell membrane damage, these are lysosome. These are lysosome. And this is lysosome cell membrane. So due to increase lysosomal cell membrane permeability, due to increase in permeability, what happens? Lysosomal enzymes leak out. Lysosomal enzymes leak out and they cause damage. They cause the damage. Because of this damage, architecture or cell outline is destroyed. Everything becomes a liquid mass. A liquid mass. So this happens in liquefactive necrosis. Whether it is coagulative or liquefactive, most common cause is hypoxia. So hypoxic cell death occurs because of hypoxia. First reversible, then irreversible, then cell death occurs, then liquefactive necrosis occurs. Liquefactive necrosis occurs. When it occurs in the CNS, liquefactive necrosis. In CNS, no collagen. Because of that, no stromal support. No stromal support. In there is myelin, so it is lip rich, lipid rich because of the myelin sheath around the nervous tissue. Because of these two reasons, in case of CNS, because of hypoxia, liquefactive necrosis is there. Other than CNS, because of hypoxia, there will be coagulative necrosis. So if we see coagulative versus liquefactive, here Lysosomal enzymes are denatured, coagulated, but here lysosomal enzymes are active. They are active. They cause liquefaction. Coagulative necrosis, it occurs in all organs except CNS. It occurs in CNS. It is it also occurs in infection where there is formation of pus. It is also seen in wet or moist gangrene. It is also seen in dry gangrene. It is also seen in infarction, whether it is red or white. So this is coagulative, this is liquid factor. If we compare microscopic of coagulative and microscopic of liquefactive, there is cell outline, there is preservation of cell architecture, but no cell outline, no cellular architecture, everything is liquefied. If you look at the growth of coagulative and growth of the liquefactive necrosis. Here the growth is this GR will tell you. GR means it is gray color. O means opaque. O means opaque. And it is firm. It is dry. Gross. And it is having cooked appearance. It is having cooked appearance. So this is the growth of a coagulative necrosis. Cell outline is architecture present, but one point was left. Cellular details are lost in this case. So lost. So growth of this, the tissue is liquefied, liquid, or it is semi-solid. It is semi-solid. And the color may be white, yellow, or it may be red in color. So these were two common type of two patterns of the necrosis. After this, we'll see special type of necrosis. Special type of necrosis. Number one, caseous necrosis. First, it is a special type. So the caseous necrosis, it is a variant of coagulative necrosis. It is a variant of coagulative necrosis. Caseous, question is why the term caseous? So caseous means cheese-like. It is cheese-like on gross appearance. The gross appearance is cheese-like. Where it is seen, Mycobacterium bovis, tuberculosis of the bovine. It is. Next question is, it is cheese-like. Why it is cheese-like? So the answer is due to mycolic acid of bacteria. Due to mycolic acid in the cell wall of MTB bacteria. So caseous necrosis is a special type of necrosis which is a variant of coagulative necrosis. Why caseous? Cheese-like. Why it is cheese-like? Due to mycolic acid in the cell wall of bacteria M. bovis. In case of caseous necrosis, what are the gross features of caseous and what are the microscopic features of the caseous necrosis? Grossly, it is cheese-like granular appearance. It is cheese-like and granular. Creamy in consistency. But in microscopic, it is very important. It is amorphic. Amorphous, no morphology. Granular. It is granular and pink in color. Pink means it is eosino, eosinophilic. Eosinophilic. Similarly, there are no cellular, no architectural details. No cellular details, no architectural details and caseous necrosis. Example where it is found, tuberculosis. Next special type is the fibrinoid necrosis. Fibrinoid. So there are two words, fibrinoid. Fibri means fibrin is there. Oid means it is due to. Oid means immune complexes. What are immune complexes? Antigen, antibody complex. So these things get deposit in vessel, blood vessel wall. Which part of the wall? Tunica, intima, and tunica media. Here they get deposited. Fibrin plus immune complex. This is fibrinoid necrosis, which is seen in the blood vessel. So in case of fibrinoid, this is the blood vessel. This is the blood vessel wall. These are the antigen antibody complexes. They damage the intima and they damage the tunica media. This is the tunica media. So they get deposited in the antigen antibody complex deposit in the wall of the blood vessel. And this is seen in your vasculitis. This is seen in bovine viral diarrhea. And on microscopic microscopic, you will see homogeneous pink color. Pink means eosinophilic, amorphous, concentric, circular, like circular, amorphous, homogeneous morphology. This is the microscopic. If we compare our previous one, that is caseous necrosis with the fibrinoid, there is only one difference on microscopic. Microscopic. And that difference is, it is caseous is cheesy material, it is granular, and it is homogeneous. Homogeneous. It is hyaline. It is not granular. Other things are same. Amorphous. It is also amorphous. Pink. Eosinophilic. Also pink. Eosinophilic. These are the differences. Next special type of necrosis is the fat necrosis. Next is the fat necrosis. Fat necrosis. Fat necrosis. Fat means adipose tissue. Adipose tissue. These are the fat cells. These are the fat cells which are having compressed nucleus. It is compressed because there is fat vacuole. It is filled with the fat, that is your triglyceride. So there is one nucleus which is eccentric, compressed, and remaining is the fat. So on histopathology, that is, if you put in solvent, then you will find empty vacuoles, because the histopathology chemicals, they dissolve the lipid. Wash or dissolve the lipid. It means if you have a normal fat tissue and here you have fat necrosis tissue, in this case, these are the adipocytes. If you pass them through your solvent, you will find empty vacuoles. Fat is dissolved. But in fat necrosis, because of necrosis, there is some calcium salt, also called as soap, deposition occur. So once you pass them through your histopathology solvent, you will find this is adipocyte with some of the deposits inside the cell. So these are your basophilic basophilic deposit inside the cell. So this is the difference between normal adipocyte and fat necrosis. Where normal cell, if you pass through the solvent, they will clear the fat and empty vacuoles are there. Or we also call them ghost cell. Only like. But in fat necrosis, there is some necrosis which after solvent passing histopathology, you will find some deposit instead of empty vacuole. So we'll see what is fat necrosis and how this soap deposit, saponification, this calcium salt can deposit inside the adipocyte. Why it is not in the normal cell. So fat necrosis is of following type. First is enzymatic fat necrosis. It is also known as pancreatic fat necrosis. Fat necrosis. It means there is role of pancreas. There is role of enzyme. Which enzyme? Pancreatic enzyme. And the name of enzyme? Lipase. So whether it is enzymatic or pancreatic, the pancreas enzyme involved is the lipase. So the whole focus will be about the lipase. So this is your pancreas and bile duct. In case of pancreatic duct, and there are some structures. These are known as acini. From the acini, what comes out? Lipase. What comes out? Lipase. The outside structure here, it is called as omentum. It is called as omentum. Omentum is having fat. Omentum is having fat. This lipase will act on the omentum fat. Suppose there is pancreatitis, acute pancreatitis in case of dog, which is very common. So because of acute pancreatitis, from the acini, lipase will come out. It will dissolve the omentum fat, and if the fat is broken down into free fatty acid plus glycerol. Glycerol will go inside the body, but this free fatty acid will help us to understand the fat necrosis. So this is the pancreas. Lipase enzyme come out in case of acute pancreatitis. This lipase will act on the adipose cell of omentum. This is the omentum. The fat stored is triglyceride, which is broken down into the free fatty acid plus glycerol. It will be utilized by the body. But this free fatty acid in the plasma, there is calcium. In the serum or plasma, we have calcium. This fatty acid will combine with the calcium and the process is called saponification. Saponification. And that may lead to formation of soap. Soap formation. So what is soap? Soap is nothing but the calcium salt. What is this? Calcium salt of fatty acid. Calcium salt of fatty acid. This calcium salt or this soap formation, if you look at the structure on gross, you will find chalky white appearance. The gross appearance will be chalky white. So this is how in dog, acute pancreatitis in dog, in pig or in sheep. It is common and it occurs in this way. And on gross, you will see the chalky white appearance. What happens at microscopic level? Because pathology is gross and microscopic, ultrastructure and molecular, four levels. So fat necrosis is there. This structure is omentum and this is the adipocyte in which free fatty acid combine with the calcium and it forms the soap. So this is the deposition. This is the deposition. See, it is a necrosis. So no nucleus. Nucleus is not there. These three dot, they are calcium free fatty acid, that is soap deposit, and these are basophilic. These are basophilic. So you will find basophilic deposit. The remaining cytoplasm is pink in color. Pink means it is eosinophilic. This is the feature of fat necrosis. So adipose tissue means normal fat and fat necrosis. Here you will find nucleus. So nucleus is there, but this is dissolved, empty. But here you will find no nucleus because of necrosis, but these three, one, two, three, they are basophilic, amorphous without any morphology, calcium deposit, which are also called soap deposit. So this is enzymatic fat necrosis. Number two is traumatic fat necrosis. It is due to trauma. It is due to trauma. That is the mechanical or physical injury. The gross appearance in this also, because it is fat necrosis, so that is chalky white. That is chalky white. Third is nutritional fat necrosis. Nutritional fat necrosis, which is also called yellow fat disease or steatitis. Which nutrition? Fish-based diet, vitamin E deficiency, and it is seen in carnivore like cat, mink. The gross features are chalky white. Number 4 is without any etiology, idiopathic fat necrosis. Idiopathic fat necrosis. It is found in cattle. Most common site of this necrosis, abdominal fat, abdominal fat of cattle. Gross is chalky white. Last is gangrene. Gangrene is a type of necrosis. For gangrene, first requirement is necrosis. Then what comes? Saprophytic bacteria, putrid, these bacteria. So necrosis plus saprophytic bacteria is your gangrene. Dry or wet or moist gangrene, because it is a type of necrosis. So which necrosis? It is coagulative. And which necrosis here? It is active. This is the first difference. Coagulative and liquefactive necrosis. Dry means there is less moisture, there is less temperature. Because of this, there is slow growth of bacteria. The invasion of bacteria will be slow. There is high moisture, high temperature, so high growth, multiplication of the bacteria. Most common site of dry gangrene, extremities. Extremities. Most common site, internal internal organs. Internal organs. These are the difference. Then, in both cases, as we know, gangrene equal to sepsis plus bacteria. Bacteria will release H2S. In the blood, we have hemoglobin. In the tissues, we have hemoglobin. This is giving oxygen. So this H2S will react with iron. That may lead to iron sulfide, FeS2. Give black color to gangrene. It will give black color to gangrene. And this black coloration is called pseudomelanosis. Pseudomelanosis. FeS2. Black color to gangrenous part, which is called pseudomelanosis. And black color because of iron sulfide that is formed from H2S and Fe from hemoglobin, H2S from bacteria. And this H2S will give foul smell, offensive smell to the gangrenous organ. What is the cause for this dry gangrene? Ergot alkaloid. In case of cattle, ergot poisoning. Wet or moist gangrene is because of Staph aureus, which is causing gangrenous mastitis in cattle. Dry, wet, and there is gas gangrene. 2 points about gas gangrene. Subtype of wet or moist gangrene. Moist gangrene. It is a subtype of this wet gangrene. Bacteria which is involved here is the Clostridia. Clostridia. Example, black quarter BQ. Enterotoxemia. There is gas formation because of Clostridia and it is a type of wet gangrene. Because Clostridia is multiplying, it means you have high temperature, you have high moisture. That is low here and low here. So it is a type of wet gangrene. And in this, you will have liquefactive necrosis. Here also, liquefactive. Here, coagulative. Coagulative necrosis. We saw necrosis, coagulative, and liquefactive. CNS and here other organ. Then caseous, a variant of coagulative. Then fibrinoid. Fibrinoid, that is seen mainly in case of vasculitis. Then fat necrosis. In dog, acute pancreatitis. Acute pancreatitis. Then gangrene. It was dry and wet. Dry is coagulative necrosis and it is liquefactive. So coagulative, liquefactive, these are two main patterns, two main, and all these are the special types of necrosis. And here most common